Are you aware that nearly half of all American women over the age of 50 will suffer an osteoporotic fracture during their lifetime? It is critical for one's health to have strong bones. If you have osteopenia or osteoporosis, or if someone in your family does, it is critical that you take it seriously. Osteoporosis is almost always avoidable. And remember, if you don't treat it correctly, it can have serious health consequences, so stay tuned. I will explain what osteoporosis is, the difference between osteoporosis and osteopenia, why osteoporosis occurs, the symptoms of osteoporosis, and finally, I will give you 5 tips for having stronger and stronger bones. What can happen to your body if your liver is overly sensitive or if you overdose? And keep in mind that it could have serious consequences for your health, so stay tuned. But first, watch the video, subscribe to the channel so you don't miss out on our health tips, and turn on the bell to receive notifications. It is also critical that you share this information with your friends and family, because our health is worth sharing when it comes to your health, so please share. Also, do you suffer from osteoporosis or osteopenia? Do you want stronger bones? Make a note of it. Come on, people. What exactly is osteoporosis? The term osteoporosis refers to a porous bone. The word itself implies that you have less bone mass and hardness. Osteoporosis causes bones to become brittle and weak. To give you an idea, they are so fragile that a simple fall, bending over, or coughing can result in a bone fracture. It is estimated that approximately 200 million people worldwide suffer from osteoporosis. There are nearly 55 million people in the United States. What are the signs and symptoms of osteoporosis? The disease usually manifests itself without any symptoms or pain, and it is not recognized until weakened bones cause painful fractures. However, there are a few things to be aware of. Height loss over time, a hunched or forward-leaning posture, back pain due to a fractured vertebra, a bone that fractures more easily than expected. Osteoporosis, is it serious or insignificant? Breaking a bone is a serious complication, particularly in older patients. Although both sexes are susceptible to osteoporosis, women are 4 times more likely to develop the disease, with postmenopausal women accounting for 1 in every 5 cases. 1 in every 20 men over the age of 50 is affected. And because it is a silent disease, many people are unaware they have it until they break a bone. That is why knowing who is at risk and intervening before it is too late is critical. What exactly is the distinction between osteoporosis and osteopenia? Both are conditions characterized by significant bone mass loss and bone fragility. The difference is in the severity of the problem. Osteopenia denotes a minor loss of bone mass, that is, it has not reached the values to be considered normal. Although osteopenia cannot be classified as osteoporosis, it can develop into osteoporosis over time. However, if properly treated, osteopenia can completely reverse the situation. Going back in time, how is the bone doing? Bone is a living, growing tissue that changes over time. It's not like a stone at all. Your bones are constantly being renewed. When you are young, your body produces more new bone than it breaks down. Peak bone mass occurs at the age of 30. What causes osteoporosis? Osteoporosis develops when the body's ability to create new bone does not keep up with the loss of old bone. The body either loses too much bone or produces too little bone, or both. The interior of healthy bone resembles a sponge or a honeycomb, what we call trabecular bone. This sponge is surrounded by an outer shell of hard bone, known as cortical bone. The holes in the sponge in osteoporotic bone are larger and more numerous, weakening the bone. Most osteoporosis-related fractures occur in the hip, wrist, or spine. The most dangerous fracture, however, is that of the femoral neck. We know that 1/4 of those who suffer this fracture die within 6 months, and those who survive have a significant drop in quality of life and independence. What are the signs and symptoms of osteoporosis? The disease usually manifests itself without any symptoms or pain, and it is not recognized until weakened bones cause painful fractures. However, there are a few things to be aware of. Height loss over time, a hunched or forward-leaning posture, back pain due to a fractured vertebra, a bone that fractures more easily than expected. Osteoporosis, is it serious or insignificant? Breaking a bone is a serious complication, particularly in older patients. Fracture in older patients can result in a loss of independence, a deterioration of health, an increase in the risk of thrombosis, and the beginning of memory and cognitive decline. Furthermore, 20% of seniors who break a hip die within a year from complications related to the broken bone or surgery to repair it. Many patients require physical therapy and nursing care for an extended period of time. What factors increase your chances of developing osteoporosis? The two most important factors are your gender and age. The older you are, the higher your risk. Another factor is bone structure and body weight. Thin and small women are more likely to develop osteoporosis because they have less bone mass than obese and taller women. Whites and Asians are more likely to develop osteoporosis. Family / history smokers women who have experienced early menopause or postmenopausal women whose estrogen levels have dropped. However, bone loss is accelerated in men with low testosterone, hypogonadism, as well as in prostate cancer and breast cancer treatment. Thyroid issues, including hyperthyroidism and hypothyroidism, if you are taking corticosteroids, or if you have problems with your adrenals or parathyroids, where parathyroid hormone produces an excessive amount of PTH. How is osteoporosis identified? Do you need to break a bone? Using bone densitometry, all women over the age of 65 or earlier, if they have risk factors for osteoporosis, should have a bone density test. Thin men over the age of 70 who have risk factors should consider getting a bone density test to assess their risk. And how can you strengthen your bones? Don't put off improving your bone health until you have a broken bone. You are never too old to begin. In fact, osteoporosis prevention should begin in childhood. How? Having a healthy diet that includes calcium-rich foods, primarily dairy products such as milk, cheese, curd, and yogurt. But for those who are lactose intolerant, dark leafy greens such as spinach, white beans, and sesame. Not only should the child eat, but he or she should also play outside, enjoy the sun, jump, and have fun. Physical activity strengthens bones, and when combined with the sun, causes the body to convert the sun's UVB rays into vitamin D. So what can you do if you aren't a child to prevent or reverse osteoporosis? Exercise is my number one tip. Exercise on a regular basis can help to strengthen bones or prevent bone loss. Activities that put a lot of strain on your bones, such as jumping, running, and weight training, can stimulate bone cells to produce proteins that strengthen bone mass. Tip number 2. Avoid addictions that harm your bones, such as smoking and drinking. According to research, excessive alcohol consumption harms bone health and increases the risk of osteoporosis. Furthermore, smoking can and does increase bone loss because nicotine inhibits bone regeneration. Tip number 3 is to consume dairy products in moderation. Certain nutrients must be included in your daily diet to keep your bones healthy. Calcium and vitamin D are the most important. The ideal calcium intake is 1,000 milligrams per day, which is the equivalent of 4 servings of dairy products. However, one study found that drinking too much milk can, paradoxically, increase your risk of osteoporosis fractures. In women, the risk of hip fracture and fracture increased by 2 to 9% for every glass of milk consumed. Also, cheese has been shown to reduce the risk of fracture and mortality by up to 15%. So limit yourself to 1 glass of milk per day. But yogurt is a different story. When compared to those who did not consume yogurt on a daily basis, women had a 39% lower risk of osteoporosis and men had a 52% lower risk. Perhaps it has something to do with lactobacilli. Ruteri is the most studied for bones, and a small study found that it can reduce bone loss in women. Protein, vitamin K2, magnesium, and zinc are other nutrients that promote bone health. Fourth tip, get more sun. Vitamin D, it's not just about getting enough calcium. Your body also requires vitamin D to absorb calcium, and it's completely free. UVB is converted by your body into vitamin D, but I can't go out in the sun because it causes blemishes and increases the risk of skin cancer. Check your vitamin D levels in your blood. If it is low, you must reset it. Exaggeration, on the other hand, is not a good thing. According to a 2019 study published in the journal JMA, when compared to people who took moderate amounts of vitamin D, adults who took large amounts not only did not see additional gains in bone density, but in some cases had lower bone mass. Fifth tip, if your doctor has prescribed osteoporosis medications, take it. We have some medications that can help with osteoporosis. Bisphosphonates are the most commonly prescribed drugs for the treatment of osteoporosis. They help to reduce fracture risk by slowing the rate of bone loss. Other options include denosumab, an immunobiological that is applied subcutaneously every 6 months. If your doctor has prescribed medication, take it. I'll say it again, osteoporosis is not a laughing matter. And for seniors, my advice is to move rugs or other items out of the way. Use guardrails and handrails. Examine your eyes and make your home brighter. Did you enjoy the video? Have you heard of osteoporosis? Remember to spread the word so that more people can benefit from this information. And what's the next video you're going to watch?